I think one of the worst things that you can do is ignore your pain and just keep pushing through. Again, that like no pain, no gain mentality. It's not what we want to have here, whether you are recovering from an injury or not. So listen to your body, do what you feel like is appropriate, and when you can't figure it out on your own, seek out help sooner rather than later. And this will prevent things from turning into bigger issues down the line. Hey everybody, welcome back to the Unchoreographed podcast. I am your host, Dr. Jenna Lower. I'm a physical therapist and dance medicine specialist and the owner of On Point Wellness and Rehab here in Gainesville, Virginia. Today, I've got another solo episode for you. And if you're new around here, these solo episodes, the purpose is to give you guys kind of some quick information looking at real-time things that I'm seeing here in the clinic as I am treating my dancers. And so this week's topic, we're going to be talking a little bit about symptom management and how to know if you should be pushing through something versus backing off. Now, this is something that I have been talking to a lot of my dancers about this week. And really all the time, I'm always talking to my dancers about this topic. But I had one in particular this week that really made me realize this would be the perfect place to bring this topic up to help you guys kind of understand what is normal and what isn't, and what is okay to push through and what isn't. Because I think it can be really overwhelming. And there isn't always great resources out there and education out there to really give you concrete reasons that you should or shouldn't push through something. And so my hope is to be able to give you a little bit more like clear-cut guidelines of what is okay and what isn't. Obviously, everybody is different. And so the best thing that you can do is talk to your own dance medicine specialist, whether that be a physical therapist, a doctor, a massage therapist, a trainer, all these different people, right, can help you determine if what you're feeling is normal or not. So please make sure that you speak up if you're experiencing issues with this. Please make sure that you speak up to your team of people and get some guidance that's more directed at your particular situation. But again, I'm going to give you sort of some general guidelines that we can go off of. So the first thing that I want to go over with you is something called the red light theory. And this is essentially using the visualization of a red light to help you know what is okay to push through pain-wise. So the thing is with rehab and recovery, we know that some level of pain is going to occur. We can't expect that you are going to come in to physical therapy and have a 0 out of 10 pain all the time with exercise if your baseline level of pain isn't a 0. Maybe your baseline level of pain is a 4 or a 5, or there's discomfort with certain movements. So if we said that you were never supposed to have any pain, then you really wouldn't be doing much of anything. Instead, what we need to do is figure out, well, what is the appropriate amount of pain that you can feel? What are you allowed to feel? What's good to feel? So using the red light, basically what this does is it breaks it down to red light, meaning don't push through that, yellow light, meaning proceed with caution, and green light is good to go. So if we look at that pain scale on a 0 to 10, 0 being no pain at all, 10 being got to go to the emergency room, your pain 0 to 4, anything under a 4 would be considered green light. It's okay to sort of push and work through, and it's almost what we would expect you to feel while you are actively recovering from an injury or rehabbing something. So anything 0 to 4, that's generally I'm like, okay, you're good, keep going through that, no problem there. Certainly, if it starts to go above that, that's when we need to say, let's look at that and see if there's something wrong there. So as we get to that 4 or a 5, now we're sort of in the yellow light. Yellow light is, okay, maybe we don't necessarily need to completely stop the activity, but we certainly need to modify it, whatever that might mean. Maybe it is no weight or lessen the weight. Maybe it's change the amount of reps that you're doing on something. Maybe we change the range of motion that you do it or how frequently you do the exercise. So there's a lot of modifications that could be made there. But moral of the story is we want to try to modify it so that that pain isn't actually going to that 4 or 5 range, but we can get it back into that green light zone. So yellow light, 4 to 5. As we get higher than that, 5 or above is what we start to consider red light, meaning we want to stop that activity. And in this case, like if you're working with a physical therapist, you would want to stop, let the therapist know, or don't do the exercise until you saw them again next. This is where the pain starts to feel a little bit sharper. There's maybe some lasting effects beyond just doing the exercise associated with it. It just overall doesn't feel good. And I don't want you to go on the premise of no pain, no gain. That's not an accurate thing to be working off of, especially if you are dealing with recovering an injury. So no pain, no gain does not apply to rehab at all. And realistically, it shouldn't apply to any regular exercise. But making sure that that pain really doesn't go into that 5 or above range is going to, like I said, that's going to be your red light. So just stop that activity. As always, make sure that you're talking with your healthcare provider to make sure that that is appropriate for you, because even then there may be some slight modifications that need to be made to that red light theory. Because again, like maybe your baseline level of pain is an 8. And so maybe a 7 is okay for you, but that's going to be on a very, very case-by-case basis, and you're going to want a lot of guidance to what is okay with that. But for the average person, 0 to 4 is green light, good to go. 4 to 5, yellow light, let's hold off and modify. And above a 5 is red light, let's just stop that activity and figure out what needs to change. So the other piece of this then is what happens to your symptoms sort of during the exercise, but also after the exercise. So what we want to be monitoring when you're going through rehab or you're struggling with pain, we really want to make sure that we are monitoring what's happening, not just during, but within probably the 24 hours following the exercise. Especially if you're somebody that's been struggling with pain that seems to be like bouncing up and down, or I like to say it's like ping-ponging back and forth. Trying to figure out a way to track what is causing those flare-ups can be really important. And so if we are going through an exercise program or a rehab program, what I generally recommend is sort of tracking what's happening with your symptoms both during the activity, so where's your pain level during, and then also what's happening in the 24 hours following. Because maybe while you're working out, everything's warm, everything feels good. But then after, you go home or a couple hours later, the pain, the stiffness, the soreness is when it really starts to set in. And it may be outside of what we consider quote unquote normal soreness. And so we have to make sure that we're paying attention to maybe, I don't feel the pain during the exercises, but that doesn't mean that the exercises aren't causing some of the problem. What's happening in that 24 hours post-exercise? Am I waking up the next morning in a lot of pain? Because if you are, then we may still need to make some modifications to exercise. So some of the things that I sort of look at when somebody comes in and asks me, well, how do I know, like if I'm not feeling pain during the exercise, how do I know if I need to change something? Or like at what point do I know I need to change something? And it can be really difficult, especially if there isn't pain associated with the movement and it sort of comes on later. But some of the general guidelines that I give, number one would be if you do feel pain with a movement or with an exercise for the first couple reps or the first set, if it's under a 4, again, we say go ahead and push through that. Wait and see what happens till you get to the second and the third set, right? Certainly if it's above that, you may want to be cautious, but if it's under a 4, go into that second and third set and see, because many times after you've done the first set and things are warm, the second set feels better and the third set feels even better than that. Sometimes the pain's completely gone by the time you get moving with these exercises. So if you're going through a movement and it starts out painful, a 4 out of 10, but it becomes better throughout the course of those sets and reps, then that is okay for you to push through. That one is probably not causing a problem somewhere. You probably just needed to warm your body up, get the muscle pumping, get some blood flow to it. So that would generally be okay. Green light, you're good to go with that exercise. If the opposite happens and the first set you're fine, but then set 2 and 3 start to creep up above a 5 and things are getting worse, again, that's when we say, okay, maybe there's something off here and we need to sort of reevaluate. Is this the appropriate exercise, or do we need to make a modification? But in general, if it gets better throughout the sets, you're good to go. If it gets worse, then obviously we want to maybe take a look at that exercise with your dance medicine specialist or whoever you're working with. Same would go for 24 hours following then. So if you get through a workout and you feel some just normal soreness, I feel like I went to the gym, my muscles are tired within the 24 hours following, then that generally is totally fine. If it's under a 4, it really isn't anything we worry about. In fact, it's probably a positive response that you got from doing some strength training. If over the course of that time the pain worsens and it goes above a 5, especially if it's starting to impact your functioning, then we want to look at that routine again and say, okay, well, maybe there was something off there that we need to look at changing or modifying. Worsening symptoms are never what we're looking for. It can be really, really difficult to distinguish between soreness versus pain, especially if you're somebody that's already been in chronic pain or you've had pain for a period of time. Sometimes your body perceives even a little bit of soreness as pain because it's so used to sort of feeling this that it sends out this alert like, ooh, don't do that, you're going to hurt yourself even more. And it may not be that what you're doing is wrong. It's just that your body's threshold for what it can handle is a little bit lower. And it's not your fault and it's nothing that you're doing. It's just the way that our bodies handle and deal with pain, especially chronic pain. And so we have to look at, well, okay, how do I know if it is soreness, which is like normal stuff, versus this is creeping over to the border of pain? And really, it's a lot of the same things that I've already said. You know, if it's under a 4, it's generally fine. If it's improving over time instead of worsening, it's probably fine. The other thing that I will usually look at too is like, does it get better as you warm up? So maybe the next day you're feeling really sore from doing this workout the day prior or from class or something like that. If you get up and you do a little bit of mobility or you take a walk or you jump on the bike and you just get your blood flowing and moving, does that soreness start to dissipate and feel better? Because if it does, and suddenly you're like, oh, okay, like I don't feel anything anymore, then yeah, it's probably just a little bit of delayed onset muscle soreness. And in that case, movement, blood flow, it's really good for it because it kind of pumps all that out of the muscles and helps you feel better. So in that case, like it's really nothing to worry about. It's probably just good sore. If it is certainly a higher level of pain and it worsens with activity, then again, probably not the best thing to be feeling. If it's impacting function, so it's really difficult to walk or point your foot all the way or lift your leg in class or, you know, whatever that may be, then we want to look at, okay, well, did we maybe overdo a little bit too much? And is that soreness creeping into the not so good range anymore? It shouldn't really impact your functioning much. You know, I think we've all been there where like you've had a really hard workout at the gym or at bar and your quads are on fire the next day and it hurts to go down the stairs. But for the most part, the more you do, like everything loosens up and it feels fine. And that, again, it's just normal, I worked out really hard sort of soreness. But if it's really impacting to the point where you're seeing inflammation or you are struggling a lot with your functional mobility, then again, it probably has re-aggravated some inflammation, again, sort of reflared things up. So you shouldn't be seeing any inflammation. You shouldn't be seeing any changes in functional status. And if you are, then that would be a sign that maybe you overdid a little bit too much, and that would be more like the bad pain that we don't want to go into. So, I mean, overall, I think one of the most helpful tips that I try to give my patients, because this is a lot to sometimes remember, you know, they come in to see me and I'm like, okay, how did the week go? And it can be really hard to remember, well, how did that workout feel? Did I have pain there? What made it hurt? You don't remember over the course of a week. So my number one tip that I give to every patient is I have them start a pain journal or a pain log. What I say is just pop it up in your phone, open a note in your phone and start to track things. It doesn't need to be anything fancy. It can be as simple as writing the date down and then saying, you know, I did my leg day and this was my pain, or it felt great. a little sore, whatever it is. Track your symptoms with your workouts. You can also do that with tracking your symptoms just on a day-to-day basis, even if it's not exercise related, but just in trying to figure out, well, what is flaring up my pain? Is it something I'm doing in class? Is it something I'm doing at school? So you take quick little notes in your phone just to start to like, oh, I sat in class for 2 hours and that really hurt my hip. Or I was fine in class, except for when I did développé at bar, and that was what hurt. Write those things down, because by the end of the week, you'll be able to look back and start to see, okay, there's a pattern here of when I'm getting my pain. And even if you can't see it, your dance medicine specialist, like as a physical therapist, I look at that and can start to pinpoint the movements that may be problematic. But then also over the course of a month plus, you'll really start to see trends start to emerge. So if you are somebody that is having a really hard time pinpointing what is flaring up my symptoms, is it exercise? Is it day-to-day life? Is it dance? Track it. You can't understand it and you can't see trends unless you track it. And so the easiest thing to do is just pop that note open in your phone and put down a couple, sentences or whatever, just to kind of jog your memory. And so you can look back at it over time and see what the trends were. And then you can start to make modifications to either your exercise program or your day-to-day activity. And so that can be, I'd say that's probably my favorite tip that I give almost every dancer that comes in that's recovering or in pain in some way. Other than that, I would say listen to your body. You guys, as dancers, you're very in tune with the way that your body feels. Your body, it tells you when something's wrong. So don't ignore that. If you're not sure, again, I tried to give you some, maybe, hopefully some more clear-cut guidelines of things to follow. But the reality is, you know your body, just listen to it. Listen to what it's telling you. If something doesn't feel right or something doesn't feel good, don't push through that. Certainly seek out help. Ask a dance medicine specialist, ask your teacher. Try to figure out if there's something that you can be doing differently, because I think one of the worst things that you can do is ignore your pain and just keep pushing through. Again, that like no pain, no gain mentality. It's not what we want to have here, whether you are recovering from an injury or not. So listen to your body. Do what you feel like is appropriate, and when you can't figure it out on your own, seek out help sooner rather than later. And this will prevent things from turning into bigger issues down the line. So I hope that was helpful for you guys. Like I said, tried to give you some practical tips and guidelines. But as always, if you have any questions at all and need a little bit more guidance on this, please feel free to reach out to me anytime. I will make sure my contact information is in the show notes below. Also, you can leave a review if you feel like this was helpful. I love to be able to share some reviews live on the podcast, and it's a great way for me to be able to connect with even more dancers. You can feel free to leave questions in the reviews as well, and I will go through those and try to answer them. Like, subscribe, share this podcast with your friends if you found this helpful. Share it with a dancer who you think might also benefit from it. And I look forward to seeing you guys next time on the Unchoreographed Podcast.